Now I will talk about three things: oral hygiene routines, different products you should know about, and which checkups we suggest you have with your dentist. I've also included a few tips. The goal of oral hygiene is clean teeth with no plaque, gums that are pink with no bleeding or swelling, and a mouth that doesn't smell bad. And what we recommend after bariatric surgery is really the same general guidance everyone else gets. In short, thorough toothbrushing with a fluoride toothpaste morning and night. Regular cleaning between the teeth using floss or interdental brushes. And preferably also daily extra fluoride via mouth rinse or fluoride tablets. Sticking with the general recommendations may sound unremarkable and might suggest it's not a big deal, but yes, after surgery it's more important than ever to actually follow these recommendations. And your own dentist or dental hygienist who knows your mouth best might give you more personalized advice. And I don't just mean brushing technique and choosing the right tools. Some people may be advised products that stimulate saliva, others may be guided to a specific toothpaste, and so on. Let us start with the toothbrush. You probably heard of brushing damage. That's partly technique, but it can also be caused by bristles that are too hard. So choose a brush with soft bristles, marked soft or ultra soft, to avoid wear on enamel and gums. We recommend replacing your toothbrush every 3 months, assuming your routine is to shake it dry after rinsing and let it air dry standing upright. People with a weakened immune system should change more often, and anyone can go ahead and toss the old brush after a cold. A manual toothbrush can work just as well as an electric one if your technique is good. Brush heads may vary a bit in shape. The point is to choose one that lets you reach all tooth surfaces well. Be aware there are special brushes and brush heads designed for cleaning around implants or where a tooth is missing. As for toothpaste, there's plenty to choose from. The key is fluoride. And adult fluoride toothpastes on the market generally have similar fluoride levels. One exception is Durafat, available at pharmacies. It has 3 times higher fluoride content and is a special toothpaste for people with increased caries risk. It should be used on the advice of your dentist or dental hygienist. There are also toothpastes specifically for gum disease. They're foamless, so they are less irritating to the gums and include ingredients that calm inflammation and offer a bit more bacterial control. And here's a tip to boost the fluoride effect of regular toothpaste. Don't rinse your mouth after brushing. The longer fluoride stays in contact with the teeth, the more it gets integrated into the enamel. In other words, you wash away a lot of the benefit if you rinse with water after brushing. And if you're wondering, the fluoride compounds in toothpaste are safe. An adult would, in practice, have to swallow several tubes for it to become dangerous. Many people are used to rinsing after brushing. A mouthful of foam can feel uncomfortable. In that case, look for what we call soap-free or SLS-free toothpaste. They're also a good choice if you're bothered by aphthous lesions or canker sores. We will also often recommend extra fluoride, primarily via a mouth rinse. You might think that will rinse off the toothpaste. Yes, it removes some of the toothpaste fluoride, but it also efficiently adds new fluoride. So it's perfectly okay to use a fluoride rinse after brushing. But note, not all mouth rinses have the same fluoride level. Some mouth rinses actually contain no fluoride. You'll find the fluoride content listed as % sodium fluoride. Check that the product you choose has a level of 0.2%. Fluoride rinse isn't only for bedtime. If you're prone to caries, it can be helpful to rinse several times a day. Here's an example in a bottle size that fits in your backpack. And one more tip. Fluoride rinse can limit damage if you struggle with vomiting after surgery. After vomiting, your teeth are exposed to extremely strong acid. If you brush right then, you abrade the enamel. Instead, rinse with water and then use a fluoride rinse. That dilutes the stomach acid while delivering fluoride to the enamel at a moment when it's highly vulnerable, reducing the impact of the acid attack. To remove food debris and plaque between the teeth, where the toothbrush doesn't reach, you can use either floss or interdental brushes. Your choice depends on your teeth, but also on what's practical for you. And the practical part matters a lot for turning something into a real habit. With floss, move it back and forth between two teeth, first hugging one tooth surface and then to the other before moving it to the next space. With interdental brushes, insert and withdraw a couple of times through each space. Choose sizes that match your gaps. Chewing gum isn't the first thing most people think of as oral hygiene, but sugar-free gum actually is helpful after meals. It gives saliva a boost and helps loosen food remnants. Saliva also brings new minerals to the enamel, which helps keep it hard. Gum can be especially useful for people with reduced saliva flow. And a bit more on dry mouth. There are various products worth knowing about. For example, there are dissolving tablets that stick to the oral mucosa and stimulate saliva for several hours, very useful at night. There are also mouth sprays that soothe and lubricate the dry oral mucosa. So, even though the basic oral hygiene package is the same as you've heard elsewhere, it's possible to choose products that fit you better. As of today, that is 2025, there are no formal guidelines or international expert recommendations on how often to see the dentist after bariatric surgery. The absence of guidance has to be seen in light of how recommendations always come sometime after the scientific evidence is available. First, we need a lot of good research. Then, this has to filter into the bariatric community where, to be honest, we don't know much about oral health and have not focused on it so far. You can see why it may take years before anything like this is added to our revised follow-up guidelines after surgery. So I'm sticking my neck out here and choose to give patients the benefit of the doubt and offer a simple two-step recommendation. Step 1. See a dentist before surgery. Tell them you're having bariatric surgery and that you want an overview of your oral health status. That will reveal any existing need for treatment, and it also gives your dentist documentation in case, for example, there's a noticeable increase in caries after surgery. Step 2. Have a checkup every 6 months for the first 2 years after surgery, either with a dentist or a dental hygienist. Hygienists have a lot of expertise in oral hygiene and prevention. The point of such close follow-up is to stay ahead if anything starts to change. Prevention is generally much cheaper than treatment, and remember, most of us pay out of pocket for dental care. After those 2 first years, follow the recall schedule your dentist or hygienist recommends. And if my recommendation is a bit on the heavy side, so be it. Many of our patients don't see a dentist regularly in the first place. And in the long run, you'll benefit from establishing a routine for checkups. And if you tend to see the dentist only when something feels wrong, prevention is too late. I hope this was useful for you and that you keep your big smile showing also in the years after your surgery.